Good morning. Before we begin, let me acknowledge that I'm speaking to you from the traditional territories of the Niitsitapi and the people of the Treaty 7 region in southern Alberta. The city of Calgary is also home to Métis Nation of Alberta, Region 3. Welcome. Thank you for joining me here today. My name is George Chahal, and I'm the Member of Parliament for Calgary Skyview. I am pleased to be with you today for this important announcement about Canada's healthcare system and long care system. I'd like to extend a big thanks to our host today, Bethany Harvest Hills, and a special thank you to Jason Copping, Alberta's Minister of Health. You will be hearing from him shortly. Finally, I am proud to welcome my colleague, Jean-Yves Duclos, who has served as Minister of Health since 2021. The Honorable Jean-Yves Duclos has been the Member of Parliament for Quebec since 2015. He previously served as President of the Treasury Board and Minister of Families, Children, and Social Development. Minister Duclos is a well-published author, conference speaker, and economics expert. Prior to 2015, he was the director of the Department of Economics and a tenured professor at the Université Laval. Our Minister of Health understands the need for permanent systemic changes to improve Canada's long care health system. He will address the issue in just a few moments. After we have heard from all of our speakers, there will be a media question and answer session. Media wishing to ask a question can do so by using the raise your hand feature on Zoom. So without further ado, I would like to welcome and invite Minister Duclos to the floor.
Good morning, everyone. Thank you for joining us at this beautiful place on this beautiful day. In a beautiful writing, George, thank you for welcoming us to your home in Calgary Skyview. It's obviously a pleasure to meet you, Jason, not for the first time, because we've been having meetings many times over the last few months virtually, but today is a special day for me because it's the first time that I meet you, Jason, physically. And I want to thank and to congratulate you on your hard work, collaboration and leadership over the last few months. You've been one of the key health ministers throughout what we've seen over the last year in my role as a health minister. And I know you know that, but I want everyone to know that our collaboration has been very, very good from my perspective and very, I think, supportive of the needs of Albertans. It's obviously a very great source of pleasure to be here at Bethany Harvest Hills in Calgary. Thank you to the team here to have been warmly welcoming us this morning. Thank you also to Jennifer and to Al of Bethany Care for all that you have done for about, I understand, 75 years. Not yourself, 75 years, but Bethany Care certainly. Now, before we begin, as George has said, I would like to acknowledge also that we are gathered on the traditional territories of the people of the Treaty 7 region here in southern Alberta. The city of Calgary is also home to the Métis Nation of Alberta, Region 3. I'd also, again, want to thank Bethany Harvest Hills for their outstanding work. We all know that there are many of you that work so hard to make long-term care homes across this province able to provide much needed care and support for people in our communities, obviously seniors, but also their families. This agreement that we're going to announce today couldn't come at a better time. We have seen over the last 2 years how a pandemic could have highlighted long-standing issues in the long-term care system, issues that were there before, but issues that have been obviously aggravated by the pandemic, such as gaps in infection control and prevention, staffing, infrastructure, and the overall quality of care, and with the tragic effects that COVID-19 has had on residents, families, and those working in long-term care homes. But fortunately, together with provinces and territories and the leadership of the health minister here in Alberta, we can do better, we have done better, and we must continue to do better. Nous sommes déterminés à travailler avec les provinces et territoires tout en respectant évidemment leurs compétences en matière de soins de santé pour relever les défis qui ont été rendus si évidents pendant les 2 dernières années de la pandémie pour ceux et celles qui vivent et qui travaillent dans des établissements de soins de longue durée. And that is why our government created the Safe Long-Term Care Fund, which is a $1 billion fund being used right now to help provinces and territories improve the safety of long-term care. In budget 2021, we also invested and announced an investment of $3 billion over 5 years, starting this year, to support provinces and territories in their efforts to ensure that standards for long-term care can be achieved and permanent changes can be made and sustained. This funding will be available to help provinces and territories strengthen compliance and enforcement activities and support workforce stability and workers in particular, including through wage top-ups and improvements to workplace conditions. And so today, I'm proud and pleased to announce that the Government of Canada has signed an agreement with the province of Alberta that will improve the safety and the quality of lives in long-term care homes in this province. The federal government is providing $115 million to the province of Alberta for infection prevention and control, to support workers, and to invest in safe long-term care infrastructure. The province in that context has developed an action plan which sets out exactly how this money will be used, and that includes wage top-ups to increase healthcare aid staffing levels, additional staff to enhance screening and cleaning protocols to reduce the spread of COVID-19 and other infections, and adequate supply of personal protective equipment for staff and visitors. That's an excellent news for seniors in this province because, as we know, conditions of care and quality of care are directly related to the work conditions of the people who work on the front lines to support our most vulnerable, and that's why and where we need to continue to step up for them. Let me briefly also speak about COVID-19. As you know, our governments have been working very hard together over the past 2 years to protect Canadians against COVID-19, including by purchasing and distributing vaccines to provinces and territories, as well as several other organizations. Vaccination is one of the most important ways that seniors everywhere can protect themselves and their loved ones against COVID-19. While vaccination with 2 doses is essential, it is now clear that 2 doses are no longer sufficient as immunity wanes over time. And let me therefore take this opportunity to remind everyone of the importance of following the recommendations of public health authorities and staying up to date with vaccination, which means getting a booster shot no longer than 6 to 9 months after the last shot. In other words, if we are eligible for a booster shot, we should get it as soon as possible. That's the best way to reduce transmission, the risk of illness, hospitalizations, and deaths. It's also the best way to protect our severely impacted healthcare workers and the most vulnerable among us. In conclusion, everyone who lives or works in long-term care deserves to spend their days and nights in a safe environment. As governments, we have a shared responsibility to protect and improve the day-to-day lives of our most vulnerable populations. Earlier this year, we also announced an investment of $2 billion to help our provincial and territorial partners significantly reduce the backlog of surgeries and treatments and diagnostics delayed because of COVID-19. That investment is part of a broader range of priorities in healthcare, and by working together on these areas, we will help ensure that our healthcare workers are better supported to keeping everyone healthy and safe, including seniors in this particular place. Merci beaucoup tout le monde. Thank you, everyone.
Thank you, Minister Duclos. I would now like to invite Minister Copping to the podium.
Good morning, everyone, and thank you, George and Jean-Yves. It's a pleasure to welcome you here to Alberta and actually meet face to face. And Jean-Yves was quite correct that we've been working together on Zoom calls over the past year through some very challenging times that not only Alberta's been facing, but the entire country in terms of managing COVID, and also working through challenges in terms of how do we support each other in dealing with healthcare staffing shortages that is not only impacting Alberta, but it's affecting other provinces across the country. So again, it's a pleasure to see you face to face and actually see how tall you are. You can't get that on Zoom. So once again, good morning, everyone. And a special thanks to Jennifer McCue and Bethany for having us to Harvest Hills and hosting us here today. You know, I'm pleased to be here with both Minister Duclos and Member of Parliament George Chahal, and to talk about this announcement and to talk about how the government of Alberta is fulfilling our commitment to treat seniors and vulnerable Albertans with the support and the respect that they deserve. And we are pleased to finalize the Safe Long-Term Care Fund agreement with the Government of Canada. Continuing care homes were disproportionately affected by the COVID-19 pandemic, given the risk factors for older adults. The COVID-19 experience highlighted many challenges and opportunities, including significant impacts to resident quality of life on mental health, impacts to family, friends, and caregivers due to visitor restrictions, and workforce challenges that led to staff burnout. That's why the government moved quickly to provide additional support for continuing care and lodge operators, including enhanced staffing, extra cleaning supplies, lost accommodation revenue, and paid student practicum positions. Early in the pandemic, additional COVID-19 safety requirements, including limits and restrictions placed on visitors to these facilities, were implemented to reduce the spread of disease and prevent hospitalization and death of residents. These restrictions were necessary to help protect lives, but also placed emotional and financial burdens on residents, families, staff, and on operators. Since the onset of the pandemic, the government of Alberta has increased financial support to the sector with a focus on human resources and strengthened infection prevention measures. To support the operation of continuing care facilities, we provided an additional $2 per hour for healthcare aid wages and funding for increased staffing levels. Healthcare aides are the backbone of the continuing care system, providing 90% of the frontline care. Alberta also invested in strengthened infection prevention measures. We added additional staffing to ensure care services were maintained, visitors were screened, and staff and residents were appropriately monitored and tested. We also invested in enhanced cleaning protocols and additional personal protective equipment for staff and visitors. We reduced occupancy within shared rooms to lower the risk of infection between residents. And overall, this investment amounted to an additional government funding of, this is Alberta government funding, of $26 million per month to protect staff and residents. That's over $300 million per year. And I'm very pleased that the Government of Canada recognized the investments made in Alberta and is helping with the extra costs associated with preventing and managing these outbreaks. So once again, thank you. Protecting seniors and vulnerable Albertans in continuing care homes has always been our government's top priority throughout the pandemic, and we appreciate all the additional support, and we will continue to support Alberta seniors. Thank you very much. And now I'll turn it over to George.
Thank you, Minister Copping. I would now like to invite Jennifer McCue, CEO of Bethany Care, to the podium.
Good morning. Thank you, Mr. Chahal. On behalf of the members of my board who are joining us here this morning, I would like to welcome everyone to Bethany Harvest Hills. It's been our privilege to host Minister Duclos, Minister Copping, and Mr. Chahal today for today's announcement. When Bethany Care Society initiated our pandemic response in March of 2020, it was a time of great uncertainty, but our focus was singular: to keep our residents and employees safe and to minimize the risks posed by COVID-19. While there were more questions than answers in those early days, as a leader, I was grateful for the support we received from our volunteer board and from leaders across all levels of government. In particular, Minister Copping, your unwavering support throughout the pandemic first in the labor portfolio and then in health, your availability to not just hear our concerns, but act upon them. And continue to be very much deeply appreciated. The COVID funding provided to our sector supported Bethany's ever-changing pandemic response needs and operational pressures and made a significant difference in our ability to confidently serve over 2,000 residents in care and housing and more than 2,000 employees. Bethany Harvest Hills opened in 1999 and for its time was on the leading edge of a purpose-built design for dementia care. It was built on a small home bungalow style concept with common kitchen and living room spaces and specialized programming to support residents and families through changes and challenges that dementia brings. Programs like Club 36, a day support program run in conjunction with the Alzheimer's Society, music, art, and gardening therapy, fostering baby kittens and equine therapy programs, and enabling technologies have helped us continuously innovate to serve hundreds of families over the past 2 decades on their often challenging journey of dementia and aging. This is what we believe in at Bethany Care Society and have been demonstrating for over 75 years. We feel privileged to meet families at what is most often their vulnerable time in life, and we are honored to serve them with care and compassion as their needs change over time. Knowing that we have all the partnership levels of government in this vitally important work is what makes our mission of creating caring communities possible. Despite the age of this building, we remain deeply proud of the community of care and service excellence that's been created here at Harvest Hills and across all of our Bethany sites. We learned many lessons during COVID. One of the most critical was that aging infrastructure created additional risk for our vulnerable seniors during the pandemic, a lesson that will require all of us to work collaboratively to address this issue across our country. As CEO of one of the largest faith-based not-for-profit providers of continuing care and affordable housing for seniors in Western Canada, I know that it will take the vision and will of all levels of government, numerous community partners, and citizens to create the kind of future we all want for the seniors in our lives today and for the seniors of tomorrow. I'm grateful for the opportunity to thank Minister Duclos, Minister Copping, and for working towards a future that is responsive in times of crisis. And I'm optimistic that working together, we can face the infrastructure and service delivery challenges of our aging population in ways that are innovative, transformational, and above all, caring. Thank you.
Thank you, Jennifer. Thank you to everybody who played a part in making today's announcement happen. This is great news for Calgary Skyview and for Albertans. My riding is just another example of how our Liberal government's safe, long-term fund is supporting Canadians across the country. Thank you again for your work on this, Minister. I would now like to hand it off to Juliette for the media availability.
Bonjour à tous. Thank you, distinguished speakers. Thank you, distinguished guests. Nous allons maintenant procéder à la période des questions. We will now proceed with the question period, starting with questions with those here with us in person. Please indicate your name and media before asking your question and limit yourself to one question and one follow-up. Oh, yes.
So thanks for the question. So this dollars, we are spending, as I indicated in my comments, about $26 million a month, and we actually have spent that since roughly the beginning. So over close to $600 million to date. So this will be the dollars, in which I'm very thankful for the federal government, will be going to things that we have already spent on, right? So in terms of protective equipment, in terms of additional staffing, cleaning, so those types of items. In addition, we're spending on top of that as well for looking at things like the wage top-up, for example, which is in addition to that, plus lost revenues, because, you know, for certain facilities, as Jennifer McCue mentioned, there were two people in a room, which was, you know, wasn't quite frankly safe. So we actually went down to one person per room, which actually helped Alberta's performance in terms of protecting this more vulnerable population. But then we needed to pay for revenue. So, you know, we're very thankful for the federal government providing the funding, and because this helps us in terms of the additional money that we are putting out on top of that.
On a federal scale, obviously funding helps a lot with staffing, long-term care facilities, healthcare facilities as a whole. But what else is being done apart from the financial side of things to attract Canadians?
Well, it's an amazingly relevant question, given what Jennifer said at the very end of her remarks when she spoke about caring. Now, caring is possible because there are people that care for others, and it's very important to recognize that the crisis that we have seen, and the crisis that we see in different parts of Canada currently on healthcare, is to a large extent driven by the fact that our healthcare workers are exhausted and have left in large numbers because of COVID-19. And in some regions of Canada, even more, in particular nurses are thinking, unfortunately, of leaving in the next year. So without workers, without people, we can't care for others. So it's all about caring for workers so they can care for patients and residents in this particular instance. So yesterday we had a very good federal, provincial, territorial conference. Minister Copping was there as well. We spoke about many things that we need to, that we can do together, that the federal government can do to support provinces and territories in their difficult responsibilities of supporting healthcare workers. We spoke in particular, one thing we discussed was the use of the $115 million announced in budget 2022 to ease and speed the recognition of the credentials of those that currently live in Canada, but whose credentials are not recognized because they have been trained outside of Canada. So there's a loss of opportunities, professional opportunities, clearly here at stake, when tens of thousands of Canadians who could be serving others and caring for others are not able to do so because their credentials and their abilities are not recognized. So we've been talking about this, among many other things, including how we support those workers that are there in the system now, not only about recruiting others and training new ones, it's also about retaining the healthcare workers, including nurses, the 400,000 nurses that deliver a lot of the healthcare services, including long-term care services across the country.
Merci, Monsieur Duclos. Merci, Mr. Copping. Next question.
Yeah. Hi, this is Amanjot from Red FM, and my first question is for Minister Duclos. Minister, federal government recently announced about the agreement between Moderna about Omicron-specific vaccine, 12 million vaccines, I suppose Canada is going to get. So we are already having around 6 million vaccines along with us. So are those vaccines being sent back to Moderna, or can you please tell us about the details of that agreement?
That's a good question. Let me speak first about vaccination and point to a few things that are either already known or will be known quite soon. So things that we already know, one thing is that COVID-19 is very much with us. It has unfortunately hospitalized and killed more people in the first 5 months of 2022 than the entire year of 2021. And over the last few months in the summer, when we would have expected the virus to be less transmitted, we've seen on average about 4,000 to 5,000 hospitalizations, compared to the average as we saw in the summer 2020 and 2021 of about 400. So our hospitals and therefore our healthcare workers keep being very much overburdened by this crisis, in addition to all of the other burdens that our healthcare workers have borne over the years. Now, when it comes to vaccination, there is one tool that is safe and effective and involves very little personal cost, is to get up to date in terms of vaccination status. And the good news is that, as you've pointed to, both Moderna and Pfizer have been submitting applications for improved vaccines that will work, that should work, based on the evidence that we have seen until now, better against not only the earlier strain, the earlier virus, but also against the new Omicron variant. And the evidence that I have seen is very positive, but obviously we will depend on the final decision of Health Canada, which is made independently based on scientific advice in the next few weeks. It should come relatively quickly. And once that is done, if the decision is to approve that new formulation, Minister Copping and myself and many others will work together so that we can make Canadians easily and quickly access that new formulation to prepare us against what is coming in the fall. Experts are telling us that the fall, unfortunately, is likely to be complicated in many, many different settings. The flu is probably going to be back more intensely. Healthcare workers are very tired and have left in large numbers, as I said, and COVID-19 will be back, unfortunately, in some cases, very intensively. So we look forward to that. The contractual arrangements, as you said, have already been not only agreed to, but announced. So we'll have enough vaccines with the agreements that we have with Pfizer and Moderna to vaccinate everyone that needs to be vaccinated to be up to date in vaccination status.
Mm-hmm. Thank you. And my next question is for Minister Copping. Minister, Albertans particularly are facing a lot of hardship in getting proper healthcare. Recently, there was a survey that around 35% Albertans, especially in the rural areas, they have to wait for around 1 year to get proper healthcare. What is the government of Alberta doing in that direction?
Yeah, well, thanks so much for the question. And this summer, I've been touring rural Alberta, talking with not only healthcare providers, but key external stakeholders about the challenges that we are facing. And you know, the biggest piece, the biggest challenge is staffing. And Alberta is not alone. Other provinces across the country are facing the same thing. So as mentioned by Minister Duclos, we're all working together. And the strategy is really threefold. Short term, it's leveraging the people that we have today to provide the services. So prime example, for example, our pharmacists have the broadest scope of any pharmacists in the country, and they can't do everything a family doctor can do, but they can do some things. So renewal of prescriptions, for example. And so we have a case in Lethbridge where recently a pharmacist-led clinics have opened up, so people can do for what they can do. They can get access to there. So it's the first step is using the people that we have to the greatest extent possible, and that's just one example. Nurse practitioners are another. The next thing is leveraging the newcomers who are here and those who want to come to Canada and to Alberta. And as mentioned by Minister Duclos, working very closely with the federal government, particularly immigration, of how do we shorten those pathways, and we can leverage that. And I can tell you that actually is working. Like, for example, I was in St. Paul recently, and they've just recruited 7 new doctors into St. Paul to be able to provide services. And then longer term, it's growing our own, ensuring that we're educating Albertans and Canadians who can actually work in the field. And as part of Budget 2022, the Alberta government announced $600 million to go towards professions that are in need here in the province. Over half of that amount, 300 million, is going to healthcare professions and colleges and universities across the entire province. So we are working very hard at this. It's taking some time, but for example, just like you may have heard in the media that unfortunately, given the shortage of doctors, the Airdrie urgent care clinic, we had to restrict the hours for evenings on the weekends. Well, we recruited 4 more doctors, and now they're as of the 19th. it's open and running again. So, we're working very hard, but we also understand that, the pandemic has put a tremendous strain on our healthcare system, and quite frankly, on the people who provided the care. And so these people are saying, you know what, this is challenging, and rightly so. They're saying, I need to go to do something else. And part of it's just demographics, but it's happening faster than it otherwise would. And we need to support them in that decision. But really, many hands make light work. So we need to invest in more hands. And so we have provided, the Alberta government, $600 million additional healthcare budget this year, $600 million next, $1.8 billion over the entire next 3 years, the highest amount ever. So we are hiring, we are bringing in more staff. We just need to train them faster and utilize them, but we will get through this. And that is, quite frankly, what I'm hearing from, particularly in rural Alberta, and is going to be, one of my key areas of focus over the next number of months, to be able to get staff so we can actually ensure that we can provide the services that Albertans deserve. Thank you.
Any other questions from the team here on site? Nope. Okay, so now we'll go over to my colleague Natalie, who's moderating the questions via Zoom. Natalie, over to you.
Thank you. We will now proceed to questions from journalists here on Zoom. If you are a reporter and you wish to ask a question, please use the raise your hand function. We ask that you limit yourself to one question and one follow-up. Unless I have stated it, please indicate your name and media outlet before asking your question. Nous allons maintenant prendre des questions des journalistes sur Zoom. Si vous êtes journaliste et vous désirez de poser une question, veuillez utiliser l'option de lever la main. Merci de vous limiter à une question et un suivi. Alors, je vais donner quelques minutes ici. I'll give it a couple seconds here to see if we have any questions online. Okay, Juliet, I'll turn it back over to you on site to conclude the event.
Wonderful. Well, thank you, everyone. This is what concludes today's announcement. Thank you for coming, and have a great rest of your day.